Hi everybody, today we're going to discuss the Wall and Lobe technique for restoring a large composite restoration. The technique is relatively simple, and I think will be something that you can do after just watching this video. So let's take a look. Matrix systems that are available are various, and these are some rings that are available for us in dentistry. The one I'm holding is a G ring from Garrison Dental, and they've been making rings with these tines with the little bevels at the bottom, these little barbs that actually help to hold onto the tooth. It's a very good system, yet the problem with the system is it forces you to apply the wedge adjacent to the ring, and that can make it a little bit difficult to apply the assembly. Garrison has different types and shapes. Some of them have long tines, some of them have short tines. In fact, you can even use them for MODs by applying two of these rings at once. The newer version utilize pads that are shaped a little bit more like the interproximal contours, but the most interesting feature of these is this U shape you see at the bottom, which allows you to place the ring on top of the wedge rather than adjacent to the wedge. A couple of other systems that are out there are the V-rings from Paladent or Triodent. These rings are essentially the same, and they can be utilized in a similar manner as the Garrison, and it's a matter of personal preference. Once again, fitting over the wedge, quite easy to use. When it comes to utilizing the sectional matrix systems, I would recommend that you find one that's very thin and has adequate contours so that it adapts well to the tooth. These are a few examples of rings that are made by Paladent or Triodent, and they can be applied to the interproximal area and maintain an adequate contour. This pin plier, which is available from Paladent or Triodent, utilizes a small pin that goes at the end of these little forceps that grabs onto these small holes you see in the band, and it helps you not only inserting them, but it also can be used, like here on the lingual, to grab the band and pull it out from between the teeth. When we apply wedges, you can purchase the wedges from the company. They make these plastic wedges in various shapes. Some of them are solid, some of them are more in a V shape, but I prefer using the wooden wedges because I find that the wooden wedges can crush up against the sectional matrix band and adapt really well to almost any contour you have. You get a grab hold of the ring with the forceps that come in the kit. The system has them, and apply the assembly ready for restoration. Notice that the ring fits over the wedge, secures the band in place, and creates some separation between the teeth, which helps to compensate for the thickness of the band. An ideal proximal restoration has seal, and that's from the gingival all the way up the proximals. It also develops proper contact with the adjacent tooth, and of course we need to have appropriate contours. And the contours are not straight, the contours are more of an S curve type of a shape emerging from the gingival up into the contact area. If you're trying to use a Toffmeyer band like we have here, you're going to be disappointed with the shape of your interproximal restoration. It won't have adequate contour. Composite resin is passive. It will flow into the shape of whatever system is adjacent to it. So even though we say these resins are packable, we have to remember that they're only packable to an extent, and they must be controlled in shape by the shape of the matrix assembly. Now on a tooth, obviously we're going to etch and use an appropriate bonding system here. On the Typodont, I like to utilize just a little resin to improve the flow of the composite in the cavity. We blow it thin so we don't have too much excess. The key here is just to create an intermediary layer that allows us to apply the resin and have it stick adequately to the tooth structure. The first step is to place the initial increment in the box area, and what we do is we fill this up to the level of the pulpal, and I'm going to use a condenser now to adapt it as best I can to the interproximal walls, axial wall, the buccolingual walls, and also up against the band. And we don't use a flowable composite for this. We use the packable composite for this particular step. It works actually quite well. The key though is it should be level with the pulpal, and that provides you with a really good starting point for developing the wall. We're then going to take an IPC, which is a interproximal carver, and we're going to pull or push the composite up against the band. And in doing this, the composite is going to raise up and it will start to develop the marginal ridge. We tap it up against the side of the band, and you can see that the composite naturally has to increase in dimension towards the occlusal. However, we don't have an adequate embrasure yet. We have pushed the composite against the band, but now we have to tease the IPC up against the band at an angle like this to create the appropriate contours with the band. The objective is not to have to spend a lot of time finishing and polishing at the end, so we're going to develop the anatomy very, very carefully, very meticulously, to avoid unnecessary amounts of finishing and polishing at the end. The goal is not even to have to use a carbide or a diamond burr of any kind to work on the anatomy when we're completed. We will use some discs to do some finishing, but we won't need to utilize rotary instruments like burrs. And I'm spending a little bit of time here. This is probably the most time-consuming step of the entire process, and arguably the most important. You have to keep in mind also that you're not only creating that embrasure at the occlusal, but you're also trying to follow the natural V shape of the marginal ridge if you viewed it from the mesial. So it rises up on the buccal and it rises up on the lingual from a low point in the middle. It can be sometimes flat in the middle, but it does have to rise up to mesh with those cusp ridges. It's fair game here to utilize a little bit of bonding resin, just a little bit, to get the composite to flow and to smooth off some of the texture. This brush is a micro brush. I utilize also very small brushes like nano brushes that are about 1/3 the size of this brush. Now at this point we're going to go ahead and light cure the wall, and then we're going to completely remove the matrix assembly. The wedge comes out, the band comes out, and we're going to essentially have taken what initially looked like a complex class 2 and converted it into a much simpler restoration, essentially a class 1. That's the beauty of this technique. Now some people say, why do you remove the assembly now? Why not leave it in place? Well, with it out of the way, you can get better access to the next step, which is to the next series of steps, which are to create the lobes and the beautiful anatomy that we're hopefully going to be able to create on a restoration of this size. This is a very large preparation. It's not a preparation that we performed, but it's one that came in a tooth that you can purchase from 𝐥𝐤 with these large preps already placed. So now we're filling the internal box area, and this is where I think you could use just about anything you want. It might be a good place to use a flowable composite. It doesn't have a high C factor. The wall is already in place. We're just inserting the material between resin and the walls of the preparation. It should be a very easy step for you to do. So now we have the step where we start to create the first dentinal lobe, and I'm using it directly out of the capsule of composite, the compule, just to show you that you can directly place it like this if you like. And you want to focus on just one cusp. This is a IPC I'm using. You could certainly use the Composite system from 𝐦𝐤𝐤𝐸, an amazing system. I'm utilizing an IPC to create the first lobe, and because I'm using a dentin shade composite, I'm going to keep this below the contour of the tooth. I'll add another dental lobe on the mesial lingual cusp, and once again try to allow the lobe to be meshing with the adjacent lobe. In other words, we're not creating a groove by adding a large mass of composite at once. We're creating the groove by allowing two positive contours to intersect each other. And when we cure this, we're going to freeze it in place. And we're placing the composite in rather quickly because this is a sub-contoured step. None of these increments will ever be seen. They will be covered with an enamel shade. So you want to pick a dentin shade now, something that is more opaque, maybe of higher chroma, and build up a sub-contoured restoration. And notice how we are allowing the material to rest against the pulpal wall without worrying about building the lobe on the lingual side right now. We're just only placing the lobe in that one distal buccal area. Now we can place the final lobe with the dentin shade, keeping it sub-contoured. We're not going to concern ourselves with the final anatomy, but we are going to try to create a little bit of the lobes that you would expect to find underneath the enamel. With this dentin in place, some people like to place stains, whatever, but I found that most patients are not particularly interested in stains. I think it's fun for us to do, but for the most part they would like to have a white looking restoration, and stains, although they're incredibly artistic and lifelike, they are certainly not always required. Probably would place stains about 1/10 of the time, and always making sure the patient understands the purpose of stains. And some of them are very excited about it. Others would rather have the tooth look almost artificially white. We have the dentin working for us to give us a hidden shade to the tooth, a higher chroma that can come through. The enamel, which is a fairly translucent enamel, but with enough white in it to create a nice look. One of the most important things about triangular ridges is to create the secondary anatomy. In other words, the grooves that are within the cusps themselves, not the central groove or the buccal lingual groove, but the groove that goes within the cusp, within the triangular ridge, and try to create a base which is wider than the top. The opposite makes the grooves look rather strange. It makes the cusp look really odd. So we're going to think about having a pyramid shape with the cusp getting wider as it merges with the central groove area. You notice that I'm taking a lot of time to remove any excess. The objective here is minimal finishing, and try to avoid having to use a high-speed handpiece with a carbide or something to adjust the enamel areas. So we're going to spend a lot of time controlling the material. And I'm still using the compule technique by adding it rather expeditiously here. I'll show you a little bit later that you can add increments with little convenience forms. You can take a small portion of the composite and add it individually. And just for demonstration purposes, I'm using a Hollenbeck carver at this point, a Hollenbeck 1-2, oftentimes referred to as a half Hollenbeck. When George Hollenbeck invented this instrument, he did not call it a Hollenbeck, half Hollenbeck. He referred to it as his Hollenbeck 1-2. One end was the number 1, one end was the number 2, but over the years, people look at the label on the instrument and see the 1/2 and think that it's a half Hollenbeck. Anyway, we're just making sure we don't have any excess beyond the lobe that we just created. We like here each lobe for a full 20 seconds. Now I'm showing you a little different application technique, and this is utilizing the micro brush, and you could use a nano brush as well. We could utilize explorers, we can utilize the Composite system. The key is to think about control. Your effort here should be create the anatomy of that one cusp, but don't let that composite push too far beyond that one cusp. So here, rather than really trying to create a groove, because remember the 𝐦𝐨𝐬𝐫𝐞 has already been cured, we're just pushing the mass of composite up against the area of the set resin on the 𝐦𝐨𝐫𝐞. And what that does is it creates this intersection of two convex three-dimensional shapes, and that is the way that the grooves get made. It's impossible to carve these grooves in and make them look realistic with a burr. It can only be done with the sculpting technique that we're showing you here. And a lot of time is spent creating these lobes and to control the composite beyond the 𝐥𝐤𝐤 surface margin for the purpose of minimizing the finishing and polishing aspects. So once again, push the lobe up against the existing lobe in order to create the groove that you're looking for. You know, composite is best manipulated utilizing kind of a tapping motion. We don't really push it or try to scrape it into position. We more nudge it into position. Like, come over here, composite. Let's go this way, and tap, tap, tap. And it tends to create a little bit more of a liquefied surface that will move a little bit better for you. Now I'm adding a convenience form utilizing the composite. So we've looked at methods for applying the composite differently. Use the explorer, use the compule itself. You can add it and smooth it off with the micro brush. You can smooth it with the explorer. I like the fact that there are many ways to do things, and because everybody has their desired techniques to establish the results that they're looking for that are predictable. I mean, it's all about doing things that you feel comfortable doing in order to get the results that you're really happy with. A composite of this size in my practice would typically take about an hour from start to finish, from preparation under rubber dam, any liners or bases that we chose to place, the incremental technique, the finishing and polishing, the occlusal checks, releasing the patient, charting, all of that could be accomplished in 1 hour. I know that's not very fast, but it is the decision to take that time. I made it a while ago because I just enjoy doing this particular procedure in this manner. I'm sure that there are clinicians out there watching this that would be able to tell me that they could do something like this in a much shorter period of time, but I am a little slow. And we now have just a small increment to add in the distal area, even giving attention to that little distal area as though it were a cusp. I think can be somewhat helpful. And it's such a small piece, I would not typically use the micro brush, but just utilize, excuse me, I would not typically use the compule. I would use the Explorer to place a little piece in there and make sure that it is controlled. And we're trying to create that little almost a triangular type of a shape that you oftentimes see on the distals of maxillary molars. Once again, spending lots of time to make sure that is not extending beyond the caval surface. When I look at natural teeth, I note that they oftentimes have features that we don't often see in our final restorations. Like what I'm doing here is I'm having a little fun. I'm adding a little mesial, almost like a mini cusp in here. We oftentimes see this on maxillary first and second molars on the mesial, and to give a little more of a natural appearance. And any excess I can then maybe place it in the central pit area here and maybe make a little bit of a nuance there. So these things are kind of fun. You have to be careful you don't go overboard, because they can oftentimes be beautiful, but they're creating occlusal problems. So it's a really good idea to know where you're ending the restoration before you really start, by checking the occlusion before you get going. But it's a nice little feature to add, and it does tend to create a little bit of realism and variability in your anatomical form. The final increment is cured for 40 seconds. So everything has been cured for 20 seconds per increment, and then the final increment is a 40-second cure, so that that last increment gets the full 40 seconds. Each previous increment had additive curing to allow it to get set properly. Now the proximal isn't quite so beautiful at this point, and it is going to require the use of a gold knife or a scalpel. We could utilize either, or these sharp titanium instruments can be used to remove this, but this is a very sharp knife, a gold knife, which was used many years ago for class 2 gold foils for removing excess gold at gingival and proximal areas. These knives are still available, and they are fantastic for removing excess composite from the interproximal areas. We can use them to create some improvements in the embrasure. Any disc system is probably going to work really well, but I happen to like this one here from 𝐬 because the discs are so thin, and there are other thin discs out there, but this disc system utilizes a metal-free center, and that can really be a bonus for you because it won't scrape up against the tooth and leave little metal marks on your composite. The disc is very carefully inserted into the embrasure areas with the disc facing back towards the handpiece. I'm using a contour angle in a slow speed or an electric handpiece at about 5 to 10,000 RPM. Keep the disc moving and allow the disc to bend as it's creating the contour improvements. We also like to change the direction so that the disc is rotating from composite to tooth whenever possible. This particular system has 4 steps. I'm just showing the first step and then one of the steps near the end. It's color coded so you know what step you're on. The discs are very floppy and very, very thin, and will adapt incredibly well to these interproximal regions. Can you do this in the mouth? Absolutely. With the disc facing inward, with its abrasive side towards the handpiece, with the handpiece in the mouth, you can do it exactly in the manner that I'm showing you here, even on a second molar. I like to pull against the composites rather than push. It seems to have more of a controlled result for us. So we've got the embrasures opened up. We're now going to use a thing for polishing called a feather light. These are made by Brasser USA. I'm sure that they're available in other countries under different names. And it's a composite finishing system that utilizes usually 2 steps. I'm just showing you the final step. And it gets into the grooves and anatomical areas that obviously you couldn't get to otherwise. And once again, using this in the low-speed handpiece or in the electric handpiece at about 5 to 10,000 RPM, maybe 15 with a very light touch. You notice that there's very little composite, if any, beyond the cable surface margin of the preparation. Now, I'm just using some resin here just to remove the excess because I'm working on a type-on outside of the mouth. Normally I'd be spraying this with water and cleaning it off, so this is not trying to hide anything or create an unnatural polish. This is simply to allow you to visualize the morphology that we've been able to create with the steps that we've shown you here. Just simply 95% of this restoration was accomplished using additive techniques and not subtractive techniques. You could acid etch the surface and apply a surface sealant. So I'm basically showing that you could cure it. But you notice how the anatomy does seem to follow the flow of the tooth quite naturally. That little bump we added on the mesial certainly adds to the overall result, and that's how we do it. I want to thank you very much for watching this video.